All right, so I can talk a little bit more about my work in the Q&A if you're curious about what we're doing at the University of Washington. But this is really the intersection of all of the research, teaching, and service that I do, is thinking about racial health disparities and specifically technology and health. So let's start with the big conversation, which I'm sure everyone usually has an entry point for talking about racial health disparities because of how much even kind of general audiences know about this topic, right? So we know that a lot of kind of ethnic minorities, minoritized individuals are disproportionately impacted by health disparities, which means that you have situations in which, for example, a Black woman is 22% more likely to die from heart disease compared to a white woman, just 71% more likely to perish from cervical cancer. And this is really the big one about kind of pregnancy related care. 243% more likely to die from pregnancy or childbirth related causes. So these disproportionate impacts on very preventable health issues is really the intersection of race and health and how inequity plays out. And globally, we know that the story is the same, especially after the COVID-19 pandemic. We understand that all of these inequities existed, and they just came to light more during COVID. The report that I shared to look at for today has a lot of great examples of how this plays out globally and thinking about minoritized populations and what results in not only individual level health inequity, but also community, social level, thinking all the way up to how policy impacts health and well-being. The key in this report that I thought was interesting is thinking about differential treatment and discrimination and how that limits access to resources for well-being. So not placing the burden on the individual level health behavior, right? It's not our sole responsibility or our fault that we're faced with racial health disparities. Some useful framings for thinking about this very nuanced connection between race and health. One of them is to talk about social determinants of health, which you might be familiar with already, right? Which is where we live, the type of healthcare access we have in that area, our health literacy, our digital literacy, what other folks around us think and do about health, and the resources we have, even financially, to address our well-being. All of that influences kind of our health outcomes, whether it be physical, emotional, or just general well-being outcomes. And so thinking about health at the social level is really useful for this conversation about racial health inequities. We're also moving away a little bit from the language of determinants of health to thinking about these as factors, as drivers, because determinants can sometimes take agency away from folks, right? Like it's your fault that you're in this circumstance, but instead, as a society, it's our responsibility to address it. Another useful framing is and this one is very much used in research, in organizational kind of development, international development, is to pay attention to the multi-level impact of these social determinants on health and well-being. So starting again from how we think about health individually, how we talk about it with those around us. The COVID pandemic really highlighted the importance of those interpersonal relationships, right? And thinking about COVID testing, masking behaviors, vaccine uptake, and how that might make things challenging for folks to make health decisions. All the way up to the organizations that we're connected with, the institutions in our communities that provide health resources, to the policies that can make healthcare access really difficult for folks who are disempowered, who are struggling to meet basic needs, and may not be addressing preventable indicators of wellness. So the social ecological model is used a lot in removing the burden of the individual to address their health. And if we think about specifically an anti-racist approach to health, this model is again useful. I found this idea of placing kind of racism on an ecological model because again, it helps us move from addressing or acknowledging disparities to figuring out what our role is and what solutions we can collaboratively think about to address those disparities, right? So not just developing cures or interventions at the individual level, but addressing the system as a whole, right? So here we have a definition of anti-racism as an active process of identifying and challenging racism and redistributing power in an equitable manner. And we can do that by changing policies and practices within systems and organizations, as well as individual beliefs, attitudes, and behaviors. So thinking of both of those collectively is usually the most constructive way to address health disparities. Now we can talk about, so many nuances of racism and health in these conversations. What I have found useful is to really personalize these connections and to think about where can we have points of empathy and points of connection to address the invisible impacts of discrimination. So a lot of research has shown us that things like racial microaggressions, which I'm sure a lot of us now understand as moments of maybe not intentional discrimination or comments that are rooted in white supremacy or kind of not very progressive ideas of social issues can be really damaging to our bodies, especially to the bodies of people of color. The experience of microaggressions and racism and discrimination over time is very much associated with negative effects on mental health. And that often aligns with negative effects on physical health, right? So things like higher blood pressure, cardiovascular disease, difficulty sleeping, and then that spiraling into just a host of health issues. So the body feels racism, and bodies of color in particular have that fatigue of having to deal with those everyday nuances of racism. At the same time, we have this more system level orientation to think about how racism is connected to healthcare, right? So we have a lot of innovative and really well-meaning, well-intentioned interventions to use algorithms and now especially artificial intelligence to help solve critical health issues and concerns. It can be a very delicate situation to use race, for example, in some algorithms that impact the outcome of care. For example, this is one instance where race was used as a construct in determining how livers are healthy or not to then make decisions about liver transplants. And the use of race as a construct in that algorithm, because it wasn't capturing a culturally tailored or appropriate sense of healthy livers, can sometimes result in Black folks, for example, being pushed down on a liver transplant list because the algorithm was ineffective in considering race. So if we operate on the understanding that race is a social construct, we get into a little bit of a muddled space of using a social construct in determining decisions about healthcare, right? And so that can be really overwhelming to sit in the space. It happens to me as a health equity researcher, where it can feel that our role is a bit intimidating, or we have a lot of work to do and we don't know where to start. So the same WHO report that I shared has really great examples of what it takes to address health disparities on the ground. And as we can see, it's a lot that has to happen, a lot of resources, a lot of tailoring. But the biggest takeaway when I look at international work in this is the intentional and the reflexive nature of doing work that is really grounded in the needs of communities. So how can we do some of this in our work? I've identified a few things that has helped me and some of my teams and the organizations I work with work through this conversation about race and health. And the first one is reflexivity. So where are we as an organization? How do we address issues of equity internally? And how is our understanding of race and racism and race and health impacting our organizational culture or the work that we do? And so this part of just being honest with ourselves, understanding that we're all entering from different standpoints and perspectives, but having a clear definition of how do we understand racism and what is it that we want our impact to be, a very bounded impact. The next is being intentional about this work, branding it as equity-centered, saying it in our materials, holding ourselves accountable, thinking about how all of our work can be oriented towards addressing, not necessarily solving, the disproportionate impact of racial health disparities. So this is an example from a nonprofit organization that talks about the why they do the work with a focus on injustice, and then the how they do the work with a focus on systemic inequality, right? So doing the same kind of development work and global health work, but being more intentional and centering that focus on justice and inequality. And then embeddedness, right? The connection between DEI work and, or like even strategic planning, organizational culture, the actual health equity work on the ground can seem daunting to think about those connections, but embedding all of the DEI work, including internal things like DEI statements, teaming norms, cultural norms for the organization, all of that can be embedded into how the work is done. But it is very contextual and depending on the equity goals that you have as an organization, right? So there's not one solution or one model for how to do this intentionally, but at least allowing the space for that conversation every step of the way is useful. All right, so we are going to start moving into a reflection activity that I would love to go on this journey with you all. This is a framework based on a liberatory design for equity process, and it's based on this reflection and intentionality and embeddedness approach that allows us to really focus on what is our equity challenge as an organization, as a team, as a board, as staff, whatever level of the organization you want to focus on. Identify your equity commitment. So what do you see? How can we empathize? How can we define? Understand the complexity of those challenges that you're facing. If it's internal, how do issues of race impact the way that your organization is structured? If it's about your work, especially work abroad, where cultures might not necessarily be open to conversations about race, how are you still thinking about systemic inequality in that sense? That's inevitably tied to race and marginalization. But most importantly is how do we act from that, right? To not get stuck in the kind of overwhelming experience of noticing and empathizing inequality. What are we going to try and do about it in our world, in the influence that we have? So A really useful kind of curriculum that I use to help organizations think through their equity challenges, and there can be many, right? Again, they can be more internal about how you operate, about norms, and they can be a little bit more external. How does the world see your organization? How do the folks that you're trying to help or make a difference in their lives, how do they receive you? And are you thinking about that, before you enter a space? So rather than establishing power over approaches, which is we're the experts and we know what folks need and we know exactly what interventions and approaches are going to work in communities, we want to establish a power with and within type of culture. To do that, it does mean that you have to try things out. You have to fail at times. There has to be disagreement, but with that openness to at least try to design solutions, right? Instead of living in a space of thinking only about inequities. All right, so this is curriculum from a really great book that I will show you the resource. It's designed for belonging, and it helps organizations think about their equity challenges, right? We're going to focus on this box on the bottom. You can move to the next one, Joe. There you go. This is thinking about, okay, we know that there are these connections between race and health, let's say, and we know that there's some things that we can work on internally as an organization, and then we want to be more intentional about our work and how it addresses inequality, especially the system level, right? Individual, community, society. Some key questions to ask yourselves, which I would love and see if you want to take a few minutes to do this now, is what do we still need to better understand? This can be about your stakeholders, about the broader system in which you operate, about your team even, and what is creating the inequity that we are focused on. Another way to think of this is, what is your equity challenge as an organization? And they might be multi-level challenges, right? But what is one challenge that you can focus on? And what are the available opportunities to try small things that will reveal more? The key here is really small changes. What are some ways in which you can be more intentional in your how you function as a team, in your communications, in your design of projects, in your prioritization of the work that you do? What are small things that can help you learn more about this connection between race and health? So if you're willing to spend a few minutes thinking about these two questions, what do you need to learn more about, and how can you do it? So I would suggest, if you wanted to do more of this in the future, what's a very helpful practice is to like write things down on sticky notes and like put them up on the wall, and getting folks online to do the same. So I can kind of tell you that in the chat, there's a conversation about hiring practices and how some small changes there have been successful. So being intentional around hiring folks who are bilingual, for example, is a small opportunity. So actually, if we go to the next slide, that's a great transition to thinking about resources for y'all. So if you identify an equity challenge that is more at the policy system level, we can look at examples of work that does that, right? If you're thinking about doing more kind of deep diving internally and asking yourselves, what's the equity work that you're doing and how does it connect to your impact? We can talk about issues of power and privilege. So I've listed some resources. The first is the Center for Communication Difference and Equity, which I co-direct at the University of Washington. We have great curriculum and programs and frameworks on interrupting privilege. So understanding, let's say, microaggressions and their impact, and then being able to have language to address when that happens in the moment. And then listening to stories of diverse folks. You have reports, from NIH and from the World Health Organization about how to bring diverse voices into the conversation on health equity, and then how to tailor interventions or programs with this intentional framing on racial and health equity. So for example, there's a COVID-19 report that's very specific to addressing the impact across all levels on the pandemic on minoritized communities, and being super intentional about what you suggest. How do we move forward, understanding that it's an equity challenge at its core? And then you have this design for belonging framework that I have found useful to move towards identifying these small steps and scoping them and putting resources behind them, right? So that they don't just exist out there, that you commit your resources as an organization, whether it's funding, some professional development, providing food at some kind of event to help folks be more supported and encouraged to come. So mapping out your priorities and then committing resources behind them, all with the intention of centering equity, right? So yes, there will be, I will send out the PDF because I feel like this was a crash course, and I'll embed some links for you all to think about for your organization, what is most appropriate for your equity challenge. Thank you for having me.
Thank you so much.
And good luck on I know you're doing more of this work on your journey.